The rising cost of healthcare in the modern world has become one of the most contentious and debated issues of our time. Every year, it seems the price of medical care, prescriptions, and insurance premiums increase exponentially, leaving many people questioning the core reasons for this phenomenon. While healthcare systems differ across the globe, there are overarching factors that contribute to the skyrocketing prices. Today, we will take a deep dive into why healthcare costs are so high, breaking down the complexities behind the system and exploring factors you may not have considered before. We'll rely on numbers and data to bring a clearer understanding, challenging some common myths along the way. 1. The US healthcare system, a unique beast. Let's begin with the US, often pointed to as the poster child of expensive healthcare. The US spends more on healthcare per capita than any other developed nation. In 2021, the US spent $12,318 per person on healthcare, amounting to nearly 20% of its GDP. Compare that to countries like the UK or Canada, where the average spending is around $5,000 per person, and you start to see the stark difference. So, why does the US spend so much more? Is it because Americans are receiving better care or more cutting-edge treatment? Surprisingly, studies show that Americans are not healthier than citizens of other developed nations. Life expectancy in the US is lower, and rates of chronic diseases like diabetes and heart disease are higher. The issue comes down to how the system is structured. Healthcare in the US operates on a for-profit model, which influences every aspect of care, from hospital administration to pharmaceutical companies. While this system fosters innovation, it also introduces conflicts of interest. Providers and hospitals are incentivized to perform more procedures and tests, often unnecessary ones, to drive profits. 2. Administrative overhead, the hidden costs. One of the most overlooked reasons for high healthcare costs is administrative overhead. In a 2022 study, researchers found that administrative costs in the US healthcare system accounted for 8% of total healthcare spending, while in countries with universal healthcare systems like Canada, administrative costs accounted for just 2%. This is largely due to the complex system of private insurers, billing codes, and fragmented healthcare records. Doctors in the US spend hours not just on patient care but also on navigating insurance requirements, filing paperwork, and battling for claims to be approved. The US healthcare system employs nearly 30 times more healthcare administrators than the UK system. The fragmentation also means higher prices for the consumer. Each step in the chain, insurers, providers, and administrators, takes a cut, and these costs trickle down to the patients, manifesting in higher premiums, co-pays, and out-of-pocket expenses. 3. The pharmaceutical industry, pricing with little regulation. One of the biggest contributors to high healthcare costs is the pharmaceutical industry, where drug prices are among the highest in the world. In the US, the price of prescription medications can be 3 to 4 times higher than in countries like Canada or the UK. For example, the drug Humira, used to treat arthritis, costs around $2,669 per month in the US, but just $1,362 in the UK. So, why is there such a significant disparity? One reason is the lack of government regulation. Unlike other countries where governments negotiate drug prices with pharmaceutical companies, in the US, drug companies set their own prices. The federal government is prohibited from negotiating directly with manufacturers for drugs covered by Medicare, which leaves the door open for inflated pricing. Moreover, patent laws play a significant role in maintaining high prices. Pharmaceutical companies can extend patents on drugs by making small tweaks to formulations, known as evergreening, which keeps cheaper generic versions off the market for longer. 4. Defensive medicine. Fear of lawsuits. Another often overlooked factor is the practice of defensive medicine. This refers to doctors ordering more tests, scans, or treatments than necessary out of fear of being sued. In the US, the fear of malpractice lawsuits drives a significant portion of medical decision-making. A 2017 survey found that almost 80% of doctors admitted to practicing defensive medicine, which contributes to higher healthcare costs. Defensive medicine leads to overutilization of services, which ultimately gets passed on to patients in the form of higher bills. A study by the American Medical Association estimated that defensive medicine contributes to as much as $50 billion in unnecessary medical spending each year. 5. The role of insurance. a double-edged sword. Health insurance, meant to protect consumers from crippling medical bills, has paradoxically become one of the reasons for the high cost of healthcare. In many countries, healthcare is funded through taxes or government programs. However, in the US, most people rely on private insurance or employer-sponsored plans. Here's where it gets tricky. Insurance companies operate under a profit model, and they often pay for services at inflated rates. For example, hospitals charge private insurers more than they charge Medicare or Medicaid for the same procedures. Hospitals know that private insurers will cover the bill, so they set higher prices to offset the lower reimbursements they receive from government programs. While insurance helps people afford care, it also insulates them from the true cost of medical services. This leads to less price sensitivity, meaning patients are less likely to question the cost of care, which allows hospitals and providers to charge more. 6. Hospitals, a profit-driven industry. While hospitals are places of healing, they are also businesses. In fact, many large hospital chains in the US operate as for-profit enterprises, with some even being listed on the stock exchange. These hospitals prioritize revenue generation, which can lead to a host of issues. For instance, hospital consolidation has been on the rise, meaning fewer independent hospitals and more large hospital systems with near monopoly power. These systems can dictate prices, often leading to higher costs for patients. A 2018 study found that prices at hospitals that are part of large systems are 12% to 15% higher than at independent hospitals. Additionally, hospitals engage in practices like facility fees, where patients are charged extra simply for receiving care at a hospital-owned facility, even if the care could have been provided at a lower cost in an outpatient setting. These facility fees can add thousands of dollars to a patient's bill. 7. The profitability of chronic illness. One of the more controversial aspects of modern healthcare is the focus on chronic disease management rather than prevention. Diseases like diabetes, heart disease, and obesity are becoming more prevalent, and they are incredibly profitable for the healthcare industry. It's estimated that 75% of US healthcare spending goes toward managing chronic diseases. Pharmaceutical companies and healthcare providers make more money by treating the symptoms of these diseases rather than focusing on prevention or cures. For instance, rather than investing in lifestyle interventions for diabetes prevention, the healthcare system emphasizes lifelong medication management, which can generate billions in profits annually. This approach to chronic illness is not unique to the US but is more pronounced due to the profit-driven model. By keeping patients dependent on long-term treatments, the system ensures a steady stream of revenue. 8. Lack of price transparency. Imagine going to a restaurant and ordering a meal without knowing how much it costs until after you've eaten. Now imagine receiving a bill that charges you significantly more than what the meal is worth. This is essentially how the healthcare system works in many countries, particularly in the US. Price transparency is almost non-existent in healthcare. Patients rarely know the cost of services up front, and prices can vary dramatically between providers. For example, an MRI scan can cost anywhere from $400 to $3,500 depending on the hospital, location, and insurer. Without transparency, patients have no way to compare prices or choose more cost-effective options. In recent years, there have been efforts to improve transparency. In 2021, a new US law required hospitals to disclose their prices for common procedures, but compliance has been uneven, and many hospitals continue to hide their pricing. 9. The impact of technology. A blessing and a curse. Technological advancements have revolutionized healthcare, allowing for more accurate diagnoses, minimally invasive surgeries, and improved patient outcomes. However, this progress comes at a cost. The adoption of new technologies, especially those used in diagnostics and treatment, has contributed to the rising cost of care. Take robot-assisted surgeries for instance. While these surgeries often result in quicker recovery times and fewer complications, they are significantly more expensive. A 2019 study found that robot-assisted surgeries can cost 20% to 40% more than traditional surgeries, and the long-term cost-effectiveness is still debated. Moreover, the race to develop and adopt the latest medical devices means hospitals often purchase expensive equipment that doesn't necessarily improve patient outcomes, but the costs of these investments are passed on to patients. 10. The healthcare worker shortage. A shortage of healthcare workers is another factor driving up costs. As demand for medical care increases, especially with an aging population, there are not enough doctors, nurses, and specialists to meet the demand. This shortage forces healthcare providers to raise salaries and offer higher incentives to attract talent, which then gets reflected in the cost of care. For instance, in the US, the average salary for a physician is $313,000 per year, one of the highest in the world. In some cases, specialists like cardiologists and orthopedic surgeons can earn upwards of $500,000 annually. While these professionals are highly skilled and their compensation is often justified, the growing shortage of healthcare workers puts additional pressure on the system, increasing costs. The shortage is not just limited to doctors. Nurses, pharmacists, and medical technicians are also in high demand. This shortage means hospitals must offer competitive salaries and bonuses to attract staff, which in turn raises the cost of healthcare for patients. In many parts of the world, especially in rural or underserved areas, patients face long wait times for basic services due to the lack of available healthcare professionals. 11. The role of government policies. Government policies also play a significant role in the rising cost of healthcare. In countries with privatized healthcare, like the US, the lack of a unified approach to healthcare regulation allows prices to spiral out of control. While programs like Medicare and Medicaid provide coverage for certain populations, they often reimburse providers at lower rates than private insurers. As a result, hospitals and healthcare providers offset these lower reimbursements by charging private insurers and patients more. In addition, lobbying by pharmaceutical companies, hospital systems, and insurance providers often influences government policies, resulting in laws that protect their interests rather than those of patients. For example, the Affordable Care Act, ACA, while designed to expand healthcare access, also led to an increase in premiums for many individuals who don't qualify for subsidies. 12. Medical debt and bankruptcy. One of the most devastating consequences of high healthcare costs is the burden of medical debt. In the US, medical debt is the leading cause of bankruptcy, with studies showing that 2/3 of all personal bankruptcies are due to medical expenses. Even with insurance, many people face significant out-of-pocket costs for hospital stays, surgeries, and chronic illness management. In fact, in 2020, nearly 18% of Americans reported that they were struggling to pay medical bills. The lack of universal healthcare coverage means that patients are often left paying for treatments out of pocket, and even those with insurance can face high deductibles and co-pays. This leaves many people trapped in a cycle of debt, with their credit scores plummeting and financial futures jeopardized. In some cases, patients are forced to choose between paying for medical treatments or basic living expenses like rent and groceries. 13. International comparisons. A stark contrast. To better understand why healthcare costs are so high, it's helpful to look at international comparisons. Countries with universal healthcare systems, such as Germany, France, and the United Kingdom, often have much lower healthcare costs per capita. For example, in Germany, healthcare spending is $6,731 per person, and in the UK, it's around $5,000. These countries manage to provide quality care without the exorbitant costs found in more privatized systems. One of the key differences is the price negotiation power of governments. In these countries, the government negotiates prices for drugs, treatments, and procedures on behalf of the entire population, keeping costs down. Additionally, many of these nations have price caps on healthcare services, ensuring that hospitals and providers cannot charge exorbitant fees. The single-payer systems found in many European countries eliminate the need for private insurers, reducing administrative costs and allowing for greater efficiency. While these systems are not without their challenges, such as longer wait times for non-emergency procedures, they demonstrate that high-quality healthcare can be provided at a lower cost to both individuals and society. 14. Solutions. How can we lower healthcare costs? Addressing the complex issue of rising healthcare costs requires a multifaceted approach. While no single solution will magically reduce prices overnight, there are several strategies that could help bring costs under control. 1. Regulation of pharmaceutical prices. One of the most effective ways to lower costs would be to implement price controls on medications. Allowing the government to negotiate directly with pharmaceutical companies for lower drug prices, as seen in many other countries, could significantly reduce the financial burden on patients. 2. Promoting preventative care. Shifting the focus from treating chronic illnesses to preventing them in the first place could reduce the long-term costs of healthcare. This would require greater investment in public health initiatives, education, and access to preventive services like screenings and vaccinations. 3. Reducing administrative waste. Simplifying the healthcare system and reducing the administrative burden on providers could save billions of dollars each year. Implementing a standardized billing system and reducing the reliance on private insurers could streamline the process and lower costs. 4. Increasing price transparency. Requiring hospitals and providers to disclose their prices upfront would empower patients to make informed decisions about their care. Price transparency tools could allow individuals to compare prices for different services and providers, leading to more competition and lower prices. 5. Encouraging competition. Breaking up large hospital systems and encouraging competition among providers could help drive down costs. In many areas, a lack of competition has allowed hospitals to charge exorbitant fees. Antitrust enforcement and policies aimed at increasing competition could help address this issue. 6. Addressing defensive medicine. Legal reforms that reduce the risk of malpractice lawsuits could help curb the practice of defensive medicine. While patients should have the right to seek legal recourse for medical errors, reducing the fear of litigation could help lower the number of unnecessary tests and procedures. Conclusion. A system in need of reform. The high cost of healthcare is a complex issue with multiple contributing factors. From administrative overhead and pharmaceutical pricing to the profit-driven nature of the system, there are no easy answers. However, by examining the various elements that drive up prices and exploring solutions used in other countries, we can begin to address the problem. At the heart of the issue is the question of priorities. Is healthcare a commodity to be bought and sold like any other product, or is it a basic human right that should be accessible to all? Until we answer that question as a society, healthcare costs will likely continue to rise, leaving millions of people struggling to afford the care they need. The path to a more affordable healthcare system will require difficult decisions and fundamental changes. Whether through greater regulation, price transparency, or increased competition, the goal should be to create a system that prioritizes patients over profits, ensuring that healthcare is accessible, affordable, and sustainable for all.